What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
Welcome back. Well, you may not know that May is Skin Cancer Awareness Month. We have Dr. William Tseng on today with Hoag, and you're a surgical oncologist, but we're here to talk about skin cancer, melanoma. And first of all, welcome.
Thank you.
And tell me about the risk factor, how serious it is. A lot of times people may hear, got so many different kinds of cancers out there, and they may not realize the seriousness of skin cancer.
Yeah, it definitely is a very serious disease. Skin cancer, the most common one is melanoma, and there's other types, squamous cell carcinoma, basal cell carcinoma, but all of them are serious, and it's important to catch them early. But in terms of the risk factors, so they're often associated with sun exposure.
Right.
Yeah, and typically the patients that we see, the patients that develop these skin cancers, especially melanoma, have fair skin and a history of sun exposure, often sunburns.
Yeah, I was talking to you earlier before you came on, just on the news this morning, on they were talking to this one young woman. I want to say she was in her mid-20s, and she had gone to, I think she said, years of going to tanning beds, and they showed kind of what she looked like and what she looks like now, and lesions all over her face, and is really quite serious, and it can progress to be more than topical, correct?
It can, definitely, and that's a very unfortunate example of what can happen.
Yeah.
Yes, and especially with melanoma, if it gets beyond just early stages, it can be very aggressive. It can even be, life-threatening.
And it metastasizes, is that what it does, like other cancers? Does it get into other parts of the body?
Yes, exactly. It can, and so typically it metastasizes or spreads to other parts of the body. Usually it's to the lymph nodes first.
Okay.
But melanoma can essentially go anywhere in the body. It's actually the one cancer that can spread to any part of the body.
Wow.
Yeah.
Yeah, again, I think most people, including myself, before I learned more about it, thinking, well, the worst case scenario is that it's going to spread in my skin. I might have to get a skin graft, and that's about it. But it's really quite more serious. How is it detected, and how should one, if they feel that maybe they're at risk, take care of it?
Yeah. So it's usually detected by a dermatologist, but it can be a family physician, internal medicine, any primary care doctor. But usually what happens is the patient gets referred to a dermatologist, and the dermatologist does a skin examination, and then he or she finds a lesion. Typically it's a mole or something that looks a little funny. And then the next step is for that dermatologist to do a biopsy, and it's that biopsy with the tissue from that biopsy the pathologists look at to make a diagnosis of melanoma, or if it's not a melanoma, one of the other skin cancers.
Yeah, I know for myself a while back, just going into a regular checkup with my primary, and they want to look at your skin and suggested, you go to a dermatologist, and there's a few things we want to be have checked out, and it was fine. But that's how the steps went. Steps went for me. But the first line of defense, so to speak, was my primary. Most people have to be referred somewhere else.
Yeah.
And a good primary, that was just part of the checkup. I don't even know what I went in for. I think it was for, like an allergy or something. But he goes, let's just, you're at an age, let's look at this here.
And I'd say oftentimes the lesion on the skin that gets biopsied, it's not necessarily symptomatic. So the patient never really says it hurts or there's any issues with it. It just, for the dermatologist, it looks funny in a way. Either it's discolored or the borders are asymmetric or there's something about it that kind of heightens that dermatologist's awareness of it.
So you talked about melanoma, basal cell carcinoma, and squamous cell?
Squamous.
What are the differences and what are the seriousness levels of each one?
Yeah. So they're all skin cancers, but they arise from different cells in the skin.
Okay.
And melanoma arises from pigmented cells. So it's the cells that give you your skin coloration and pigmentation. And among the three, melanoma is the most aggressive. And it's the one that has the highest chance of spreading if it's beyond the early stage.
Okay.
So it's the most aggressive out of the three.
Okay, and what about the other two? I myself had the basal cell, which they quickly removed, and that was kind of the end of it.
So the basal cell and squamous cell are a little different, that they're typically a little less aggressive, although there are situations such as patients that have immunosuppression or other kind of comorbidities, other medical conditions that could make it more aggressive. But basal cell tends to be more of a localized tumor, and often it's just a simple excision. Sometimes the dermatologist can treat that just in their office. And same thing with squamous cell, although squamous cell I would say is probably a little bit more aggressive than basal cell. It does have a chance of spreading, especially if it gets bigger, if it has more aggressive features on it.
Okay, the prevention of it. Obviously in this community here, you have a lot of people that grew up in a time where, there may not even been, there certainly wasn't sunscreen, and back then, a lot of people would, put on probably the worst product you could think of, to get that deep, rich tan. So they've gone through years of this, but what can be done now, later in life, and obviously earlier in life, to kind of know what to do?
Yeah, well, I think sunscreen is an important part of this, protecting the skin from sun, and specifically it's the UV exposure from the sun, and then I'd say just as the story that we had talked about earlier, with teenagers and younger people that are interested in tanning beds, I would definitely stay away from that. Tanning beds are they're actually recognized by the World Health Organization as a carcinogen. So I would say definitely stay away from that for the younger people. And then for the older population, in terms of there's nothing really per se in terms of prevention other than what we talked about, but regular visits with at least a primary care doctor, preferably a dermatologist, I'd say, to pick up on any early suspicious lesions on the skin.
Okay, and tell me about the Hoag program. You have the Advanced Skin Cancer Program and Melanoma program.
Yeah. So we're located at the Hoag Family Cancer Institute, which is right behind the Hoag main hospital in Newport Beach.
Okay.
And we consist of a multidisciplinary team of physicians. So we have a dermatologist, we have surgical oncologists such as myself, medical oncologists, radiation oncologists, even pathologists, even radiologists that all focus on melanoma and skin cancers. And we work together very closely, and we take care of patients all the way from early stage disease to advanced stage disease. And we even have a high risk clinic.
Oh, very good.
Yeah.
You also said that you also are on the faculty of, did you say USC?
That's right.
And this is what you teach?
It is.
Very good.
Yep.
So you know your stuff, and we certainly know the reputation of Hoag. And as you said, get yourself checked out as just part of your routine physical, and have your primary, if that's who you go to first, give a look at your skin, and a good primary is going to be able to say, you know what, you need to take this further. I'm going to refer you to a dermatologist or whatever it may be. And even now, use your sunscreen. And you have to use more than most people think, and I understand it's best to use sunscreen to apply it, although sometimes we just don't do this or have the time. Several minutes before you go out into the sun, right?
That's right.
Yeah, and it can wash off, despite that, you know, some of them say waterproof or sport proof or whatever it might be.
That's right. That's right.
Yeah. I once saw that the amount of sunscreen that you really need is quite a bit to put on. So you got to keep that in mind. But take care of yourself. If anything, a broad brim hat always helps. And,
Sure.
you know, we need a little bit of sun, but don't overdo it.
It's
great to meet you.
Yeah, very nice
to have you here. And again, I'm going to give you, or I want to give you the website, Hoag.org, of course, but then you can see you have the /melanoma, and that's going to bring you to Dr. Tseng's area. And good to have you on, good advice, and serious subject, and you need to take care of it.
Yes.
All right.
Thanks for having me.
We'll see you again, I hope. We'll be right back.